I came in here precisely on the invitation of the organizers, Lisdal, to participate in this important one-day dialogue on health security financing, which is what we are really witnessing, today. We all know the pandemic has made each and every one of us aware of the fact that there is nothing today as important as health, because no matter how wealthy you are, no matter how well placed you are, without proper health, eh, you will be nowhere. We have seen how many number of people you see dying was influential, and those from the low you see class. So we must really prioritize health. We must strengthen our health system. We must ensure that we have more money into the health sector. We must ensure judicious utilization of funds within the health sector. Today, as it is, the generality people have mistrust, are not really confident about what is really happening, because a lot of money is being pumped into the health sector, even though it's still inadequate. But people are not seeing results, you see, for it. Our health incidence indices are still very poor. We still have high mortality rates of infant, mothers, men, their age, and what have you. So it shows that our health system is not really working, very well, optimally, the way it should really be. Like I said, we are lucky in the sense that in Nigeria, the pandemic really, given what the World Bank, World organizations had really expected, but the devastation has not really been too much, in the sense that the number of deaths, being recorded is not really high compared with what we were told we were going to really witness in the beginning of COVID, sometimes, last year. But still, nobody is really happy with the situation of the country's health system today. Well, the legislature are doing the best that they can. I'm no longer in the legislature, but I know that they've been doing their best in terms of trying to increase funding. Currently, there is a bill. The National Health Act of 2014 is undergoing legislative process, which will see an amendment. And part of this amendment is targeted towards increasing the 1% of the Consolidated Revenue Board, which goes to Basic Healthcare Provision Fund, to be increased from 1 to 2%. So they're doing their best. They're trying, you see, to really improve on their oversight, and calling on government to ensure prompt release of money, prompt utilization of resources, so that people can have confidence in the health sector. People really can ensure that when they are sick, they can get to the hospital and get adequate, affordable, and accessible services.
This project is called Prevent Epidemics Project, which is being implemented by Legislative Initiative for Sustainable Development with funding from Global Health Advocacy incubators. And the essence of the project is to ensure that we mobilize more domestic resources to support health security related initiative, and to ensure that government at national, state, and local government level are more responsive to the issue of health security and epidemic preparedness and response. So the government is spending more money, but not only spend more money, but to ensure that the money is actually delivering the result, ensuring there's efficiency, ensuring that there is increased accountability for it. And it's part of the activity we're having today to bring stakeholders together to deliberate on how do we raise accountability bar for health security financing in Nigeria. It is very, very important for us to engage various stakeholders. A multi-sectoral engagement is very, very important. Work with people that in the Ministry of Health, Ministry of Finance, economic planning, civil society, the media like you, to come together first and foremost for us to have to be on the same page with regards to why is it important for us to invest more on health security. We are all living witnesses to what is happening as a result of COVID-19. It's affecting all walks of life. So it's very, very important for us uh, to establish that it is very, very important. It's something that is of optimal importance that we really have to pay attention to. So that's the first thing for all of us to be on the same page in terms of why it is important. The second stage is to look at what are the priorities that we really need to spend money on. You listen to NCDC; they have highlighted important areas in terms of where we need to invest money, and they even told us how much that it costs. So when we are now gauging the stakeholders, we'll be able to tell them that this plan has been costed, it's cost so amount of money, so please allocate money. And we are seeing results as well. Like for example, for the first time, Kano State has been able to create a budget line for air security, and they allocate 300 million with commitment that they are going to release the money. But we're not going to relent until the money is released and actively utilized. And civil society engagement is very, very important. We are not doing it alone. Civil society members are involved. They are the one following up with the policymakers to ensure the money is allocated, the money is released, the money is utilized, and tracked from the community as well. And I believe the members of the media has a very important role to play as well. In Nigeria, the allocation to health sector is grossly suboptimal. We are looking at, if you look at all the benchmarks, we are looking at 15% allocation of government expenditure. We are doing like 4 to 5% in Nigeria. We are looking at another benchmark of 1% of the GDP spent on health. 5% of GDP spent on health. In Nigeria, we are doing less than one. Another benchmark, we are looking at $86 spent per person on health. And Nigeria is doing around 12, $13 or thereabouts. So in terms of benchmarks, we are not there. But we have the opinion that it's very important for us to continue to engage and change the narrative, not just to see health as a mere expenditure, to see health as a critical investment that is necessary for one human capital development and necessary for improving the economy of the country. So we have to change the narrative.
In ensuring that people have belief, people have changed their notion about the COVID-19 pandemic. And not only the religious leaders, but the entire stakeholders, including traditional institutions. You see, in Kano State, lot of engagement have took place. His Excellency, the Governor, the Tabla Umar Ganduji, spent complete 1 week sitting face to face with all the stakeholders. He started with traditional institutions. Traditional institutions in Kano State is a very robust structure that cut across all the communities. We have 5 emirs in Kano State, and because people have believe in them, because people know their voice, they stand with them. People tend to agree whatever policy is passed through the traditional institutions. So His Excellency has engaged quite with all the traditional institutions and has also engaged the religious leaders and by in their support. And they are doing a lot in that aspect of engaging, sensitizing the community, and that is why we are having a lot of successes, especially with regards to observance or compliance to COVID-19 protocol.
Stakeholders engagement is very key. We need to engage people. We need to engage people at their own level to be able to really understand the subject in place. For us to be able to engage people, we need to share with them what is in position, the threat, the consequences, the benefits. That will go a very long way in letting people cue in into whatever issue is being brought before them. The basic thing is for people to be able to understand what is in place, the importance of what is in place, and the benefits of them complying to whatever the government introduced as far as health security and healthcare services is concerned. So when they are really being carried along, when they know the issue, when they understand it, they can be able to now participate and really agree with whatever resolution is being agreed upon. So for us to engage people, we need to go down to their level and let them understand whatever subject matter is in place for us to be able to benefit. Because government alone cannot do it. People have to understand, people have to participate, people have to also accept for us to be able to achieve. Yeah, so the issue of uh, diseases, the issue of healthcare, security, financing, is a very key issue because nothing is possible without finance. And then the importance and the priority of healthcare cannot be overemphasized. So for healthcare to be really funded, every hands have to be on deck for us to be able to fund healthcare effectively and for us to be able to succeed in the programs and agenda as far as healthcare delivery services is concerned. Funding is key, commitment is key, understanding of the community is very, very key for them to be able to queue in. And the commitment, of course, and political will of the government is what is more primary for us to realize, for us to be able to record benefit in whatever agenda as far as health security is concerned.
I'm excited. In fact, words are not enough to express my happiness today for receiving this award. I'm very grateful to Lisdale for this award. Well, in terms of epidemic response and financing in Kano State in particular, where I'm coming from, on my capacity as the Director of Public Health and Disease Control, we make sure that we forecast and make ready estimates for government in terms of budgetary allocation, what we need to have on ground, all the resources. In fact, we are the eye of the government as far as that kind of analysis is concerned. And it's through this analysis that government comes to know about the need and requirement, at least for the year, to be able to provide adequate budgetary allocation so that we can finance all the forecasted epidemics that may come up in that year.